Health, they say, is wealth and has a direct impact on the quality of life and productivity of people anywhere on the globe. It is therefore not surprising that the Nigerian government, through the Millennium Development Goals (MDGs) office, has continued to display keen commitment towards ensuring that Nigerians, particularly those at the grassroots and hard-to-reach areas, enjoy unfettered access to health services. Since the inception of the administration of President Goodluck Jonathan, over 5,000 health facilities have been constructed via the Millennium Development Goals Office in hundreds of communities across the country, while others have been renovated, supplied with drugs, and equipped with modern facilities aimed at ensuring that no stone is left unturned towards providing qualitative health care for the people. Beyond the provision of health-related infrastructure and equipment, the federal government, through the Office of the Senior Special Assistant to the President on Millennium Development Goals, has gone a step further by evolving programs which are designed to ensure that people take full advantage of healthcare facilities and services through the provision of a sustainable strategic solution to the underutilization of health facilities in primary healthcare systems, particularly in remote and undeserved communities. Of particular interest to the federal government of Nigeria has been Millennium Development Goals 4 and 5, which emphasize on the reduction of infant mortality and improvement of maternal health, respectively. The efforts of the Office of the Senior Special Assistant to the President on Millennium Development Goals in this regard has continued to yield impressive results as it applies systematic approaches towards the unmitigated achievement of the goals in question. This has been made possible through the implementation of well-articulated programs which have had far-reaching impact on the well-being of the people. One of such lofty initiatives is the Village Health Workers Scheme, which was formally launched by the First Lady of the Federal Republic of Nigeria, Her Excellency Dr. Patience Jonathan, at a grand ceremony held at the State House Banquet Hall in Abuja, the nation's capital, on 4th February 2014. According to Dr. Precious Kalamba-Benyor, Senior Special Assistant to the President on Millennium Development Goals, the Village Health Workers Scheme is a unique program aimed at generating the required impact of better community health outcomes through specific objectives.
The scheme is one that has been carefully planned in collaboration with stakeholders, particularly state and local governments, and the national and state primary health care development agencies. The Village Health Workers Scheme is a world best practice with basic principles of establishing a link between the community and health services, as well as providing the much needed avenue for generating demand for ease of access and increased coverage of services. The scheme is expected to make the required impact of contributing to improved community health outcomes by increasing uptake and utilization of health facilities provided by the Office of the Senior Special Assistant to the President on the MDGs.
The creation of the Village Health Workers Scheme can be said to be both timely and necessary, given the past negative inclinations of the people, which posed a stumbling block to their unhindered access to affordable and professional health care. This has been a result of negative traditional and religious beliefs and a deep misconception of matters of health generally.
It will surprise you to know that some community people believe, though they have primary health care centers in their communities, but they do not really know, that they can really access these facilities. Even though for some of them the clinics are close to their houses, but the impression they have about the clinics is that it's very expensive, it's meant for the elites, or the drugs in the clinics do not really work, or when they get to the clinic, sometimes they don't even find anybody in the clinic. They lack hospital consumables So because of those kind of issues, most of them don't really bother to waste their time to go to the clinics.
We used to have few cases of antenatal care, mothers coming in for antenatal access, antenatal care. The reason was basically because this community is highly residential and it's more like a slum, grade A, more like a grade A slum here. So we have a lot of traditional birth attendants around us here that are competing with the primary health care centers and private health facilities that we have. So many of our patients are lost to them, even if they come here. In fact, at that time, they weren't even coming for antenatal per se. You had very few people coming in. So we knew that we had a gap.
This community, they don't want to come to the clinic to receive this medical antenatal. Some of them, they will just relax at home. They will not even come to the clinic for medical care of their pregnancy or their babies. Some of them, even the babies are not well, they carry them to these Mamayara places where they will go and receive herbs.
Our people are very funny, Somebody will be pregnant, come and register. She will not. Time for birth, she will be calling for these people. Whereas they are here from morning till night, every day. They will not register. They will not come. If they want to come, it is at the peak of the deliverance. So such a thing brings, at least, it won't give a fair delivery. Most at times, the child get died or may be safe, or they will refer this case to the general hospital.
Before the advent, we've been having our peculiar problems across the states. That is, the level of patronage, rather access to healthcare, was a little bit low, and then the distribution of health facilities is to some extent lopsided. Therefore, some cannot access healthcare easily because of the distance and as well because of the terrain of some facilities.
For these reasons and more, people were often lukewarm about visiting the clinics regardless of the degree of ailment, and this ultimately results in a downward plunge of their individual and collective well-being. With the introduction and launch of the laudable MDGs-Village Health Workers Scheme, there now exists a vital link between individuals, households, and the communities and the various available health facilities. The village health workers are charged with the task of sensitizing and mobilizing the general public to utilize health facilities, conducting routine household visits to communities, members, recently discharged patients, pregnant women, and anyone in deep need of primary health care, reporting prevalence of health-related cases in parts of the community or ward, working with local government authority and community health facility authorities to facilitate effective delivery of health facility management packages and the distribution of long-lasting insecticide-treated bed nets in the community or ward, carrying out campaigns and advocacy to encourage and enhance utilization of health facilities, hygienic living, etc., supporting linkage and distribution of contraceptive commodity and the likes.
I used to go to every household teaching the women how to keep their environment clean, telling them to use the primary health care we have in the community. I'm also advising them not to deliver at home. I am also telling them that they should go for antenatal in the PHC. I'm also telling them that whenever they feel sick, whether their children or husband, they should come to the primary health care.
We always visit the people house to house, and the advice is all about personal hygiene, including environment hygiene. That is, we show them how to take care of themselves and how to take care of their environment. And when they are sick, they should go to the hospital, and they should not be using traditional medicine and modern medicine. that they should not be mixing it. And all these pregnant women, I used to advise them. So, and they will say they have been giving birth at home, that they don't want to go to the hospital. We always tell them that the consequences of not going to hospital during pregnancy. So even me, I used to escort some to the hospital. And I always, sometimes if I didn't go, I would tell them that they should go. They should tell the doctor that it's one village health worker that came and told them to go to the hospital.
My job is to mobilize people, to let them know their left from their right, to come to when they are sick, they should come to the clinic, they should not be at home, and they should not use arms or use drugs where doctor did not prescribe. They should always come to the clinic and see the doctor.
So far, a total of 3,740 village health workers have been recruited, trained and deployed to 261 local government areas nationwide. The Office of the Special Assistant to Mr. President on Millennium Development Goals not only provides them with the necessary kits, but also a monthly stipend aimed at encouraging them to effectively carry out their duties. An additional 2,100 Millennium Development Goals village health workers are currently being recruited across 210 local government areas nationwide. In a bid to determine the impact of the Millennium Development Goals Village Health Workers Scheme in already benefiting local government areas, an impact assessment was embarked upon via two separate baseline surveys. In the first survey, held in March 2014, data on the rate of utilization of the health facilities for a 6-month period preceding the commencement of the scheme was collated. The second survey was concluded in November 2014, and this shows the new rates of utilization over the last 6 months in the same health facilities. Highlighting the results from the Village Health Workers Scheme Impact Assessment in Comprehensive Health Center, Kunchi Local Government of Kano State, the results show that the number of women that attended antenatal sessions increased by 48.8%. From 623 to 927. The number of deliveries increased by 275% from 24 to 90. And the number of children immunized significantly increased by 363% from 211 to 977. Based on the empirical data available, it is obvious that the scheme is changing health outcomes in communities, especially hard-to-reach areas across the country, as more women and children are being enrolled for antenatal care and immunization, amongst others. There is no doubt that the program has impacted positively on the lives of the people. One of the reasons attributable to this success has been the rare commitment exhibited by the village health workers themselves, which the people deeply appreciate.
Truly, the village health worker assigned to our community has tried. She has taught us a lot of things based on the training she received. We have gained a lot from her regarding personal hygiene and also how to address all sorts of health issues as they arise.
These village health workers that were recruited have been of immense value to our women folk. Our women have learnt a lot from them regarding health matters. They are working hard to sensitize our people, especially the women who before now did not know the benefits of visiting hospitals when they are ill. Now, people readily go to the hospitals without prompting, which is a good thing because it means it is health all around for everybody.
I want to thank His Excellency and also the President who have found us worthy to be one of the persons that will have to carry out this program of village health workers in Abia State. And also, I want to state that this has really impacted in improving the health of the mother and child, which is MDG 4 and 5. And the village health workers have really done well because they go into the nooks and crannies of the local governments trying to speak to women. And my staff and with the children have really found out that they've gone high into the society, and it has really impacted well because now women try to assess the healthcare. They ask for what they need because they've been made to understand that health is very relevant in their well-being.
The village health workers in our communities are really trying. They have educated our people on the importance and benefits of going to the hospitals for proper medical attention. Before now, our women, for example, did not like going to the clinics even when they were pregnant. Fortunately, the orientation has now changed. These days, all the clinics are full to capacity with people coming in for one reason or the other. That is why we are asking MDGs to please provide us with more clinics because the available health facilities have become inadequate.
As the countdown of the 2015 deadline of the Millennium Development Goals draws closer, Nigeria can proudly beat her chest with the knowledge that the goals are not only being assiduously pursued, but the impact of various programs such as the Village Health Workers Scheme are visible and enhancing the standard of living of the people.
A very important program that will save the lives of our children, the lives of our women, especially our rural population, and even the men also in the rural areas. The village health workers have a big role to play in linking up the rural populace to our healthcare facilities.
I want to commend my sister, the Senior Special Assistant to Mr. President on MDGs, for the strides she's been making since she assumed the leadership of that office. So congratulations and well done. This administration has done wonderfully well because of his commitment, because of his passion, because of the interest it has for our women and children. The results are paying off. In 2012, they found that the maternal mortality ratio has fallen from 545 per 100,000 to 350 per 100,000. We are not there. No single woman should die. But when progress is being made, that progress must be recognized. I thank you all.